Appendectomy is a surgical procedure performed to remove the appendix, a small, tubular organ attached to the colon in the lower right abdomen. Appendectomy is typically done when the appendix becomes inflamed or infected, a condition known as appendicitis. If not treated promptly, appendicitis can lead to a ruptured appendix, which can be a life-threatening emergency. Here's a detailed explanation of the appendectomy procedure. Preoperative evaluation. Before undergoing an appendectomy, the patient typically undergoes a series of evaluations, which may include a physical examination, blood tests, and imaging studies like ultrasound or computed tomography (CT) scans. These tests help confirm the diagnosis of appendicitis and determine the severity of the condition. Anesthesia. Appendectomies are usually performed under general anesthesia, which means the patient is unconscious and doesn't feel any pain during the procedure. In some cases, a local anesthetic may be used to numb the area around the incision site for minimally invasive procedures. Surgical approach. There are two common surgical approaches for appendectomy. Laparoscopic appendectomy. This minimally invasive approach involves making small incisions in the abdomen. A laparoscope, a thin, flexible tube with a camera and surgical instruments, is inserted through one of the incisions. The surgeon uses the laparoscope to view the inside of the abdomen and remove the appendix through one of the incisions. Laparoscopic appendectomy typically results in smaller incisions, less scarring, and a quicker recovery compared to open surgery. Open appendectomy. In an open appendectomy, the surgeon makes a single, larger incision in the lower right abdomen. The appendix is removed, and the incision is closed with stitches or staples. Open surgery is sometimes necessary when there are complications, such as a ruptured appendix or the presence of an abscess. Appendix removal. Regardless of the surgical approach, the surgeon will isolate and remove the appendix. The appendix is then ligated, tied off, to prevent any leakage of infected material into the abdominal cavity. If the appendix has ruptured, the area around it may be thoroughly cleaned. Closure. The incisions are closed with sutures, staples, or adhesive strips. Sterile dressings are applied to the incisions to protect them. Postoperative care. After the surgery, the patient is moved to a recovery area where they are closely monitored. Pain medications and antibiotics may be administered as necessary. Patients are encouraged to start moving around as soon as possible to prevent complications and promote healing. Depending on the type of appendectomy and the individual's condition, the hospital stay may vary from a few hours to a couple of days. Recovery. Recovery from an appendectomy depends on the surgical approach and the individual's overall health. In laparoscopic appendectomy, patients often recover more quickly and experience less pain. Most people can return to their normal activities within a few days to a week. In open appendectomy, the recovery period may be slightly longer. Complications. While appendectomy is generally a safe procedure, there can be complications, including infection, bleeding, or injury to nearby organs. In rare cases, postoperative complications like abscess formation or prolonged ileus intestinal paralysis can occur. It's important to note that appendectomy is a common and well-established surgical procedure that is performed to treat appendicitis. Prompt diagnosis and treatment are essential to prevent a ruptured appendix, which can lead to more severe complications. If you suspect you have appendicitis, it's crucial to seek medical attention.